Welcome, everyone, to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and I am really excited to have a guest here with us today, all the way from Singapore. Dr. Jon Marshall, welcome to the show.
Thank you, Lisa. It's an absolute pleasure to be here. So I am in Singapore, but I'm originally from Melbourne, Australia, a city that you know very, very well. And it's an absolute honor to be here. Thank you for inviting me.
It's so great to have you here. Well, a little background. So Jon and I met at Michigan State. He came all the way from Singapore at the time to Michigan State. He's got a background. He's an osteopath, acupuncturist, does dry needling, and also a martial arts expert. I can't wait to hear a little bit more about that. And so we met, and he's been taking the courses at Michigan State, and I just heard has joined the faculty. So I'm very excited about to have him as part of the team there. And then he brought me to Australia because he has, I know you're going to talk about your manual medicine program that you have in Australia, where he teaches other chiropractors, physical therapists, and osteopaths, different kinds of manual techniques. So I want to just jump right in and, give us a little bit about your background and, a bit about your businesses, because you have several.
Yes, mine's a bit of an unconventional story. My route into manual medicine, I started quite late. So I finished high school when I was just before 18. I took a 10-year gap year, which is a long time, and my parents were very happy when I finally did get accepted into RMIT to study osteopathy. But I started Aikido, which is a Japanese martial art, when I was 10 years old. And that's where my misspent youth was spent, pretty much at the dojo, keeping out of trouble, but training most days. And all I wanted to do when I finished school was to go to Japan. And the headquarters of the style of Aikido I do, which is the Yoshinkan style, is in Tokyo. So when I was 21, I saved up some money after working in hospitality for a few years, and I meant to go for a year. And I stayed 7 years. And while I was there, I was introduced to, the Beijing University had a branch, an acupuncture school there, the TCM. So it was the Beijing University of TCM. And they had a program in English taught by a Chinese professor in Japanese, translated into English. So that got me interested in manual medicine, I guess. And this was in 1998, and I'm not sure about the States, but in Australia, acupuncture, although it had been practiced for a while, was still quite new, and it certainly wasn't trendy. So, people's reaction of sticking needles into people wasn't, it certainly it wasn't trendy. So I became kind of more interested in osteopathy. And so in Australia, it's a 5-year program. For your US listeners, it's a bit different because we can go straight from high school, and it's a five-year degree. So it's a 3-year bachelor and a 2-year master's. So the method of osteopathy we do is it's manual medicine based. So it's not like DOs in the States. So we don't prescribe medicine or surgery. But yeah, it's basically 5 years of manual medicine. So it was a good foundation. And after I did that, I was a sucker for punishment. So I went back and did a 3-year master's in acupuncture, which kind of came back to where I began. And I started to incorporate both acupuncture and manual medicine, which I find, that's kind of my niche, and that's what I find gets really, really good results. And as an extension of that, I founded Manual Medicine Australasia in 2013. Mm-hmm. Which was, 2012 it was. We just celebrated 11 years. And it was dry needling for basically osteopathic students, physio students, chiropractic students, and of course, practitioners of those different disciplines. So I've kind of found my way to success. I didn't mean to start these courses, but there was such a demand. And at that time, there was no osteopaths teaching. So physiotherapists or physical therapists in the States kind of did it, but it was very, it was quite different. So yeah, it was something that just took off, and yeah, we've been doing it for 11 years now, and we travel throughout Australia, Southeast Asia, Japan, and I'm actually going to Europe next year to do a few courses. So yeah, it's very exciting.
Excellent. And you have two or three maybe clinics, right? Back in health in Australia
Yes.
and in Singapore.
Yeah, so the back in health, I was running the Australian one during COVID. So I moved to Singapore. Just a bit of background. I had a kind of a reverse midlife crisis. Everything was going so well in Australia. This was pre-COVID. Had two clinics going, had my dojo, and an opportunity came to move to Singapore. And I had a 2-year-old and a pregnant wife. And so it was a bit of a leap of faith, but I decided to do that. And I mean, looking back, it worked out spectacularly. But COVID happened a year after we came, and Australia, I don't know if you know, but Australia was nicknamed Fortress Australia because everything was shut. We couldn't go back. They couldn't leave. It was about for just over 2 years, I think.
Yeah.
So, you know, if I had stayed in Australia, I don't know how that would have gone. So I kind of got out not knowing what was going to happen, but it really kind of reinforced that it was the right decision. Yeah, so again, being the smartest person in the room is not my forte, and I wasn't sure. I didn't have a job when I came. I just decided I was going to open a clinic in Singapore. I taught here a few times and had some contacts, and I just decided to do it. So yeah, I started back in health in Australia in 2009 and kept it till about 2020. And then one of my associates took it over. I
Okay.
just wasn't able to, I was still paying rent. We were paying half rent, it was closed, and it was really draining financially. So one of my associates offered to take it. Basically, it was gifted to him. And then I didn't have to pay double rent. So that was
Okay.
amazing. And so I started back in health in Singapore in 2018. And there's a sub clinic called the Singapore Headache and Migraine Clinic. So we specialize in the
Right.
manual therapy approach to treating headache and migraine, which has been really, really successful. Especially, I'm not sure what it's like in the States, but it seems to be the protocol here of doctors is to just hand out a bunch of medicine to
Yeah.
migraine sufferers and
Yeah.
not really address those lifestyle factors that are so, as we know, are so important. So that took me on a different journey, and now I'm finishing my master's in headache disorders at the University of Copenhagen. So
Wow.
that's an amazing program. I meant to do that in 2020, but because of COVID, it's held every 2 years, so it was put on hold. And it's an incredible course. It's 2 years with 6 trips to Copenhagen over those 2 years.
Wow.
So I'm up to 3. I've got one in June, straight after certification, like the day after certification,
Oh,
and
wow.
yeah, it's a bit crazy. But it's the program's unique in that it's open to neurologists. In our class, there's 22 members from 18 countries. The neurologists, GPs, a brain surgeon, 2 physios, and 3 osteopaths. So
Wow.
it's really, really cool.
Sounds
So
really great.
yeah, it's very unique. But as my wife says, you don't have to do everything. It's I keep going down these really cool rabbit holes, and I'm going to talk to you about that a bit later about the importance of continually upskilling as a practitioner, as we all know is very important. But this is just an amazing course because where I've spoken to some other people, especially Dr. Lisa Di Stefano, and we're thinking of kind of putting something together aimed for manual therapists. So, incorporating cranial, osteopathic technique, exercises from manual medicine where you come in. So
Yeah.
there's a whole really big chance to collaborate with other professionals and make people realize that there are other choices besides medication and just accepting it. So yeah, migraine and headaches been super. Yeah, it's just done really well, and we've been getting really good results
That's
by
so
treating.
great. There's
Yeah.
such a need for that. I mean, you're absolutely right. You know, typically that is the first line of treatment for migraines. It is to give out medication. So the fact that, you know, you've got a whole clinic that focuses on that and you're doing this additional training, I can't wait to learn from you and, you know,
Yeah.
get,
That's,
you know, yeah, get some tips and tricks. So let's maybe move into that because you've given us a great background about your journey and your businesses and kind of what you're doing. So now let's talk a little bit about, you know, tips that you've learned along the way that have helped to give you the best outcomes. And you come from just such a great background. So I'm really interested to hear what you think your top three are.
I think well, three is hard because there's so many, but
Right.
I think like patient-centered care is the main thing, and I think that you know, it's not just osteopathy, but it's one of the tenets is that uh, you know, function and structure are interrelated, but there's no cookie cutter approach to treatment. Like everyone is different, everyone is unique. So our goal, like at my clinic, is like the patient. We want to know their why are they here, and how can I help them? So I think that's really important. And once you get that out of them, you know, it's something like migraine and headache. Like we say, we can help to decrease the intensity and frequency. There's no magic on and off button, but you know, it's you're part of the process. It's not me doing things to, you know, giving you interventions like therapy or needling or whatever. The patient has to be part of the process.
Yeah.
And that's just as a segue, and that's why I really enjoy. I'm not blowing smoke, but that's why I really enjoyed your course with exercise, because exercise prescription for me was always something that other people did, and I wasn't very good at it, and not I just didn't know how to approach it. And I remember speaking to you, and I did your course at Michigan State, and hence coming to Australia, and you said the same thing. It's all about the patient. It's all about giving them, you know, what they need. And we've just opened a studio space in our clinic so we can facilitate that, because you know, you give people exercises, but they really need you to help them do it. And you know, some people like that, some people don't, but it's definitely all about the patient. And secondary, I don't know if this is number 2 or 1.5. I think the patient can tell when if you're all about the money. I think you know, if you just do a good job, you have I don't want to sound naive, but you know, good intentions. You want to help. You know, you can't help everyone, but you can help. You know, you want them to be able to help them help themselves, and I think that's really important. But if you're all about money, and I think people can sense that,
Yeah.
and if you want to help someone and you're genuine, I think then that's probably the main or the most important thing a therapist or a manual medicine practitioner can develop, because if you're sincere and genuine, then people will buy into what you're doing, and you're, you know, they're meeting you halfway. You're not doing the whole thing. So I think that's super important.
Well, that's so true. And, you know, sometimes I think telling people that you can't help them and finding somebody maybe who can. And sometimes I think that is sometimes even more valuable, right? Is so when people come to me, if I feel like, you know, this is just not something that I can help you with, then I like to have a big network of people to go, okay, let's try this person, you know, or maybe it is they need an MRI or they actually need surgery. They want to hear that, right? Not maybe that they need surgery, but as opposed to, well, let me, you know, just keep seeing you and keep seeing you. I mean, I tell my patients, I don't know what you do, but, you know, within the first, you know, 1 to 3 or 4 visits, I want to see a pretty significant change. And if not, then I'm starting to think about, okay, you know, what else could, you know, be going on here, and should there be a different intervention, and am I really what this patient needs? So I really
Absolutely.
resonate with
Yeah.
that.
Yeah, I think what you just hit the nail on the head, because that multidisciplinary approach is so important, you know. And to anyone listening to this, if you're not already, or you're just starting out on your journey, it's really important to get a good network of people. Like get your GP, get your neurologist, your physiotherapist, you know. And as I said before, I don't have to do everything, and I can't do everything.
Yeah.
But and I think people are very grateful if they ask you a question, like, I don't mislead them or talk crap. If I don't have, I'll tell them I don't know,
Right.
and I think that's fine as well. But here is someone who will, who can help you,
Yeah.
and people really like that, I think. So
Absolutely. And, sometimes I'll say, I don't know, but I'm going to find out, I mean, I have a very complicated patient right now that, has a 90%, tear in her hip. And we've been kind of, brainstorming with, okay, she's had some, bone marrow injections and she's had, a variety of different things. And she certainly has gotten better, but from an overall function perspective, is she a surgical candidate? Some say yes, some say no. So I'm like, okay, what else could we be doing? Looking at some, bracing and, just constantly trying to be thinking about, all right, what are all the options for this person to best maximize their function,
yeah,
So,
I see it a lot. Yeah, I mean, in that kind of sports and spinal world, I mean, I see a lot of that as well. But I have some physios that I refer to. Like if someone needs some ACL rehabilitation, like that's not my forte. But hands-on manual work is. So
right.
we have a good cross referral like that. But yeah, definitely, staying in your lane is very important as well. I think.
Yes.
But yeah, that's probably number 2 or number 2.5.
Right.
And lastly, I would say, oh, it's hard, but you just got to work on yourself. You got to, if you don't know something, it's up to you to find out. I mean, if it's something that, for me, if it's an osteopathic, how to do an MET, or if I'm unsure, I've got to ask the best in the business who can help me. And that's why I decided to, I go down these rabbit holes. It's just because I find it so fascinating. So it
Yeah.
started from acupuncture and osteo, and it's just kind of grown. But yeah, after this master's, that's a lot. Well, never say never, but I think if I want to keep a happy wife, I better start. Yeah, I don't know if it's diminishing returns anymore, Lisa, but I just find it so fascinating, and I want to be able to. It's all connected. It's the same.
Yeah.
The trunk's the same, but all these different branches. So,
Well, I'm with you, and I can absolutely echo that, you have to constantly be learning and growing. And I probably have the same with, with my husband. I mean, in the last, probably just, 2 months, I've taken like 2 major kind of business learning, classes and
yeah.
and it's just, I love it. I think we love to learn and grow. And I think to give the best care, you just got to keep learning and searching and, sharing information. And so, yeah, so I'm right there with you. We're never going to stop learning.
No, till the day we die. Well,
Yeah.
fortunately, it's a curse maybe, but it's a good one. And that's why I found organizing seminars for manual medicine. I was teaching at the courses, the dry needling section, but there
Yeah.
was so much interest in, doing a high velocity course or an MET course. And we used to do these kind of master classes, and it was only 4 or 5 hours on a Saturday afternoon. So in Australia, a lot of practitioners will work Saturdays. So they'll
Okay.
finish, 1 or 2 o'clock, whatever. So we'd have like 3 till 8, and maybe some nibbles or some drinks afterwards. And I invited some well-known osteopaths, and it was very basic. And I was just like, I was expecting some fancy stuff, and people loved it. And it was just because they're stuck in their room. Some of them are one out; they don't work with any other people. And it was a socializing event, and it was kind of one woman told me, it's like, I'm glad I'm on the right track. Like, I haven't done this stuff since uni. And I think sometimes you can go a little bit left field. And it's just good to have that reinforcement, but also meeting with your peers every once in a while for,
Yeah.
professional development. And that's why I love Michigan so much, because it's a long way to go, but for me, it's the mecca of manual medicine. And yeah, and I'll keep coming back for as long as they'll have me. So
Yeah.
it looks a bit longer now. So this
Well,
is good.
and I'll tell you, not only I think is it great to be a learner, but when you have to teach, right?
Absolutely.
you learn even more, right?
Yeah.
Because you have to prepare for lectures, prepare for questions. You never know what's going to come at you. And then students ask you stuff, and it sometimes makes you think in a whole different way and go, well, I'm not really sure about that, but I'm going to find out. And then it just kind of stirs up, more and more, that you want to learn. And
Yeah.
so I think
100%.
it's a great, a
Yeah.
great
And
way to
one other thing that I remember Dr. Carl Steele says in his when I took his course, and it was like professional or a master is someone who has mastered the basics or something to that effect.
Oh,
Do you
yeah,
remember?
yeah. So that was actually Dr. Greenman that
Oh,
said
Dr. Green, pardon me. Yeah,
experts do the basics the best.
that's the one. Yes.
That
Yeah, and
is
that really
that is
resonated with
true. And
me.
we say that all the time, it's like you don't have to get fancy schmancy. You just have to, again, know the basics, and then you build from there. So once you understand the foundation, then it's easy to kind of add those little caveats.
Yeah. Oh, yeah,
Yeah.
that really resonated with me.
Yeah.
I did remember it was just I couldn't recall it, but yeah,
Yeah.
it was that made a big impact on me because in the
Yeah.
martial arts, it's the same. Like, common things occur commonly, and if you have a good grasp on the foundation and the basics, then they work the majority of the time. So
Yeah.
I like that application to manual medicine. So yeah, that made
Yeah,
a big
it's so
impact on
true.
me.
I say it all the time too when I teach, because you just got to keep bringing people back to, again, do the basics. And when you get really good at that, then you
You can
can,
freestyle.
yeah,
Yeah.
absolutely.
Yeah.
Well, those were great. Those were great tips. And absolutely, like I said, resonate with those. So let's think about your particular audience, right? So, you have patients, you have students, what do you hear time and time again that from your, the people that you kind of work and influence, what do they appreciate the most?
I think it's just what we talked about is kind of getting out of their comfort zone and learning something different. So, taking time out from their busy schedule to learn, it can be expensive. But for me, it's one of those things that it's such an investment into your own practice. And for me, the dry needling kind of, I mean, I'm not the pioneer of that in Australia by any means, but I've taught a lot of osteopaths, and I've met people that have said, like, you've changed my practice, you've changed my life. And it's just kind of like, wow, like it's really a massive, like, just sometimes we take it for granted, just the impact that you can have on someone.
Yeah.
And I'm not saying that to get a big head, but I met a guy coming from Melbourne to Singapore, and he was a student that I taught. And he said, I totally changed the way I practiced, and I've been getting these great outcomes. And I see that every day in my practice, and that's normal for me. Like, well, that's just how I treat.
Sure.
But for someone to take on board what I've said, it was just like, wow, that meant a lot.
Yeah.
And sure, there's people that have come to my course saying, oh, well, maybe I didn't learn a thing. I hope not, but I'm not saying it's all positive, but I think it's just mentors in all, whether it's business or in our industry, are really, really important. And
Yes.
I look at the Michigan MSU staff, yourself, Dr. Carl Steele, Dr. Lisa DiStefano, they're my mentors, and I can ask questions, which is incredible. And a lot of people don't have that. And so,
Yes.
I've started a group for our needling students, and it's a private group, but we have masterclass. It's all free. It's all ask a question. It's like, an hour a month where we might do a Zoom masterclass, and people can kind of, if they have a question or, what problems you're having, we can kind of workshop it. And yeah,
I
so that's
love
been,
that. Well, I'd like to join that group.
yeah, sure. I'll send you the invite.
Because
I'll send anyone.
I'm sure I can learn a lot from you from needling. And, I talked about, wanting to brainstorm about that because that
Fantastic.
would be
Yeah.
fantastic.
Yeah. So I guess, I mean, being in that role of being able to make an impact on people's like how they treat and even their lives, that's pretty cool. But I've been impacted by so many great teachers as well. So one expression that really resonates with me is like, a great teacher doesn't tell you what to look, will tell you where to look, but not what to see. And so
Mm.
they'll show you where to look, but they don't tell you what to see. It's up to you to
Yeah.
discover that. But sometimes you just need that nudge in the right direction.
Yeah.
And I love pushing people down rabbit holes because I'm always going down.
Follow me.
Yeah, yeah.
Come on.
So, yeah. So any spouses watching this, I'm very sorry.
I
Yeah,
know.
it's all for a good cause. But I think that's probably how my answer to your question in a very perhaps convoluted way.
Yeah.
Being like making an impact and continuously learning. I think that's pretty much what I want to give to my audience.
Yeah.
And of course, patients. I mean, going down that path is that we do our very best to help them and to get them out of pain. And as you know, like you've seen cases where people have walked in severe pain,
Yes.
migraines, neck pain, lower back pain, and for us to be able to use our skills and knowledge to be able to help that, I mean, it doesn't
Yeah.
get, it
It
really
really
doesn't get.
doesn't. It really
Yeah.
doesn't. It's, yeah. It's, I feel, we're so blessed to have the kind of careers that we have, that we can help people in that way. And, the osteopathic techniques, the dry needling, the combination, of things that we're using, really is what gets those great outcomes. And it, yeah, I'm with you. I love it. Absolutely.
Yeah.
Well, is there anything else of value that that you have that that you'd like to give our audience?
Yeah, so if anyone is interested in, well, you can join our Facebook group. I'll put all the information up
Yes,
or down
in the
later
notes.
on.
Yes.
Yeah, and so manual medicine, so the website's manualmedicine.com.au, so AU is for Australia.
Yes.
So yeah, basically our courses are kind of down in the
Down
southern
under.
hemisphere, down under. But we will be, there's potential to do, we may be doing some stuff in the United States at some stage, and collaborating with the famous Dr. Lisa Chase as well would be fantastic. So watch this space. I think there's a lot coming. And if anyone has any questions, especially if you're just starting out, I'm not the greatest businessman. Sometimes I feel like I'm a money repellent. So it just comes and it goes out, but we get by where, we live a good life here in Singapore. The weather's usually in the early to mid 80s in Fahrenheit. So
Nice.
kind of blessed like the weather where you are, I
Yes,
guess.
like Florida.
So it's very tropical. It's beautiful, great people. Yeah. So we've been here 5 years now, and we're just trying to, keep kind of expanding and making an impact in Southeast Asia to start with, and Australia, of course. So
Yeah.
yeah.
Well, it definitely sounds like you're doing that. Well, yeah, I will definitely put all your information in the show notes, and so people can find you. And I look forward to seeing you in a couple of weeks. We'll be
Yes.
at Michigan State together. So and I know we'll be talking here before then, but I really appreciate your time and your insight
Thank you
and
so much.
sharing with our audience.
It's always great to see you, and you've been a massive impact on my career as well, and especially with the rehab links that really changed my practice. So what I said before about something, it's definitely true. And if anyone is wanting to learn how to incorporate in a very easy, structured, and systematic way, then I can't recommend rehab links enough. So yeah, I've gone through that book many times. Your online course gets a workout at least once a month. I like just doing it in different sections. And yeah, if I struggle with something, I look it up. So it's been a great resource, and I really, I encourage everyone, and I have, to the students in Australia to sign up, because it's worth its weight in gold.
Oh, well, that's fantastic. And maybe we can coordinate another trip so I can come to Australia again and maybe bring you to the US. That would be awesome.
100%. That'd be
Awesome.
fantastic. Thank you, Lisa.
Well, excellent. Well, thank you so much. And until next time, keep getting great outcomes.